Hi, Dr. Makani Lew here. I want to show you how to do the Williams Flexion Biased exercises. These are used for when there's low back pain, maybe due to a disc, inflammation, something hurting the nerve in the low back, so it's radiculopathy. And the patient finds that being in lumbar flexion, the radiculopathy goes away. So it's a peripheralization to centralization switch. So it's a flexion biased set of exercises. Williams exercises are really stretches, and they're traditionally done for about 10 seconds per hold. There's no harm in going longer. So let me show you them all. Starting in a supine position with the knees up in a hook lying position. Patient will do pelvic tilts to cause their low back to go flat. So posterior pelvic tilt. The next thing they can do is draw one knee, the involved side, to their body. And they can hang out there for a while. The second one is hold both legs like this, and it should give relief. And I always add in roll side to side because a lot of people say that really helps. Then they can do like a little baby crunch. And the idea again is posterior pelvic tilt, flexing lumbar spine, giving relief. So kind of like this. After that, the next item is when they're sitting up. A lot of people say this is a hamstring stretch, probably the worst one ever, meaning that's not how I stretch my hamstrings. But if you let them bend their knees a little bit and let them bend over, it's a wonderful lumbar flexion. So legs can be straight or knees can be bent. We get lots of lumbar flexion. Okay? That's all the floor parts. Now let's go up. So the next one, the next one I like to do usually is a kneeling flexion lunge, but I'm going to show you some more floor stuff. Child's pose is an optional one you could do. I always include it though. Curling up into a little flex ball. Then there's also just the classic squat, kind of just go into a flex position that helps them feel relief from their leg and in their low back. Then the last one would be the flexion biased lunge, and it can be done, I'll continue with the left leg. It'll be left leg's radiculopathy, be kneeling or standing, bring belly to knee. You don't need to really worry about how far back the other leg is. It's just the flexion in the front is really what you want to feel. Other options, let me move the camera, would be sitting in a chair and just going into flexion. Of course, just standing up and reaching down towards the floor in a toe touch. So that's the Williams protocol stretches for somebody who has radiculopathy and low back pain that gets relief when they're in flexion, so it's called a flexion bias. Of course, don't do any of these if it hurts. So that would be a contraindication of a flexion intolerance. That's it.